there was supposed to be something. Okay, let's call this meeting to order and get started. We're going to start with Senate Bill 31. I think we had all the discussion that we needed to have yesterday. I heard all I wanted to hear. I think we hit the topics. Representative Lott, is she here yet? No? Okay, well, we have to stand down. Okay. Jessica, she has an amendment. All right. Huh? Okay, they're making copies. Okay. All right. What do we have on the other one? Okay, Senator, what do we put on this one? Nope. Sorry, we're having to stand down. Where is she? Which amendment do you have? Amendments. Huh? Yeah. Is she up? Position on the bill. All right, we had discussion yesterday, so do I hear a motion on the substitute to Senate Bill 31? And moved to pass, do I have a second? Okay, we've given a motion to pass and second. Any brief discussion? Since we discussed it last time. Okay. No. I won't accept one. Okay, sorry. Representative Lott, we're not ready yet. Okay. Representative Peake?
Yes, ma'am. Madam Chair, just briefly, I want to give a strong encouragement to vote yes on this piece of legislation. It comes down to choice in my mind. We as Republicans fight for choice. Democrats fight for choice every day here, and at a time when citizens are at their most vulnerable spot of dealing with cancer and possible end of life, they ought to have a choice to make the decision of where they want to go for treatment. So I hope strongly urge us to affirmative vote on this bill.
Representative Hilton.
Oh, thank you.
Do you have your?
I think I'm on. I would just like to say, as a former cancer patient who was treated at Georgia Cancer Specialists and have had treatments at Kennestone Hospital and Wellstar. I think we just should be really cautious about this. I don't think it's really a matter of choice. I think there are a lot of other issues involved, and I think it's something we need to really think about our communities, and think about. I know there's been a lot of hype from cancer treatment centers of America over the last several years. But to me, it's been, not trying to influence anybody really, but just making a statement, just seems like it's been a good bit of oversell on their part. And with that, that's my comment.
Representative Jaspers.
Yes, ma'am. Well, I would just like to echo Chairman Parsons' comments and looking at I'm sorry I wasn't here yesterday. I was ill. To see this, see what's been crossed out, the agreements that were agreed earlier, and looking at just the indigent care report that I've gotten from previous, haven't met the requirements they agreed 2 years ago.
Representative Jaspers, I think we went into great detail about that yesterday. I'm sorry you missed the meeting. DCH had approved their way of figuring that. Okay. I said DCH had, not the current people in DCH, but the past people in DCH had told them to figure them a certain way. And they followed DCH's orders. Okay. I just wanted to answer that question for you.
Yes, ma'am. I just had a different number and that I had received earlier this year, and
Right.
that's just what I was going off of.
Well, I'm just not. Representative Hatchett.
Thank you, Madam Chair. Can you hear me? Am I on? Okay. I would like to just say that we heard a lot of testimony yesterday, a lot of very passionate testimony from all the sides. And the way my looking at this has been for the past at least 4 years since I sort of got involved is sort of along Representative Peake's vision is that we have a center in this state that provides cancer treatment, and agreements were made, and we all know that people come back all the time for changes to what they've agreed to previously. But we are telling Georgia citizens that they cannot get treatment at a facility in their state, even if they want to. And it's not a free choice, and I really hope that we can move to change that somehow. Thank you.
Okay. To correct you, Representative Hatchett, once they can get treatment up to where they reach a 35% threshold, and then if they've seen more than 35, so some Georgians can be treated there, just to make that clear. Okay, Representative Henson.
Same thing as
Right,
you.
is that some can, that just is a cutoff level, so, okay. Are we any closer to getting, was somebody ask Lynn?
Yeah, Lynn was getting them, so.
Okay. All right, Jessica, can you see how close she is?
Lynn and Liz are on the way to
Okay, let's, huh? Yeah, we just stand at ease for a minute. What? As we Lot, you want to go ahead and explain the amendment? Are you, you're on.
Okay. Thank you, Madam Chairman. I would like to say also that we've gotten plenty of emails and responses to this issue from both sides, and it's very important, and it's important to the whole state. And I have great hesitation to allow this CTCA to remove themselves from that conversation that was had years ago. But, and that being said, I also have a problem with certificate of need, and my community has struggled with trying to get things established, either to remodel a wing that was done in 1972, and it takes 6 to 7 months to get a certificate of need just for them to do their own projects. So there was a lot of debate in my mind. I'd like to say where we came up with some of these amendments. The first amendment that I have, and you should have it in your packet, is AM 331757. This amendment is kind of a little bit of basically a bargaining tool of sorts, and it is to put a sunset on the request that is being made by CTCA. Whereas after 5 years, they revert back to their 3565. This gives us, the 5 years was chosen based on study committee in the Senate talking about the length of time at which, you can look at data and how long it should take something before you can really calculate things out. So we put that in there as a 5-year, and it'll sunset on July 1 of 2023. It's a little bit wordier than just that, because in working with Betsy and Legislative Council, what we've learned is that they may expand their beds, and then after that point, they would be out of compliance with the original. So the wording is just to allow them to expand their beds, but at that point, they can expand no longer, and they have to revert back to the 6535. That's that amendment, and I will take any questions if anyone has questions about it.
Okay. Questions on the amendment? We're not going to vote on it till we get a copy.
Will you have a copy of this one, ma'am?
You've got a copy of this one?
You should have
Oh.
a copy of AM 331757.
You got it? This is the original. Okay. Okay. Do you want to wait for your second version?
No, I apologize that I've confused you. This is the actual amendment and the correct version.
Okay. All right, if everybody will look at the correct version. Okay. Do I have a motion on the amendment? Okay. All right, I have a motion and a second. Is there any discussion on this amendment? No discussion? Everyone in the favor of the passage of the amendment AM 331757, say aye.
Aye.
Oops, sorry, not me. And everyone opposed, no? No. Okay. I think that's probably too close to call. It sounded like the ayes have it. Let's have a hand vote. Everyone in favor of the amendments, raise your hand. Okay. Anyone opposed? No? Okay. The yeas have it, and the amendment passes. Okay. Do we have another one? Do you have another one?
I do, yes, ma'am.
Okay, and that's the one we're waiting on?
No, this is in your folder as well.
Okay. It's in everybody's folder except mine. What? No, sorry, I got it now. It's over in Leo's folder.
Thank you.
Okay, his pile. All right, this is Amendment AM 331760. Okay, Representative Lott?
Yes, ma'am, thank you. This amendment what it does is it removes from the certificate of need process, or the certificate of need requirement, alcohol, drug abuse, and mental health services. Therefore, if a hospital or public entity would like to come into the state of Georgia, or a hospital that is existing in the state of Georgia would like to take on those services, that they do not have to go under the certificate of need review. For mental health services, alcohol, drug abuse, and mental health services is what is removed.
Representative, can you please tell us why we would have this amendment? And this about the alcohol and drug and abuse treatment?
Yes, ma'am. So, I would hope that many of us on this committee would already be aware of this, but we certainly have an opioid crisis in this nation, and we have a need for mental health services in Georgia, and we do not have, we should not, in my opinion, have any limitations placed on anyone that is willing to come into this state and provide those services to our citizens.
Representative Henson?
Madam Chair,
Yes?
I don't necessarily disagree with the issue about the opioid crisis, but I do have a serious problem with this being added at this time with no discussion about what it really means beyond the fact that
Okay. I think Representative Henson, and I think this is what I'm getting at, is that the reason this was added and I let it be put forth as an amendment is because one of the problems that we have, and we talked with Representative Sharper's bill, and one of the problems why people don't want to expand to EMTs is because we don't have any place pretty much to send people that have mental health problems. Those facilities across our state have been closed down over the years. And as you saw with the massacre in Florida, there's a demand for more taking care of mental health patients. And that is why that amendment has been put on there as a consideration for the committee, is to, without delay, try to up our resources for treating the mentally ill. As you know, as you can see, there's been a demand for us to do more for the mentally ill. And if you don't have a place for people to go, you have a real problem with getting people care. And that's just the reason
Madam,
sure, go ahead.
I agree with you that we need places, but as someone on this committee, I don't know how those get created, what process they have to go through, with or without a CON. And that's my concern. I mean, this is a totally new issue. And I agree we need more places. But again, what is the process? And I don't like voting on something I don't know anything about in terms,
Okay.
Or can
Representative
explain.
Henson, I understand, and you have the right to vote yea or nay on it. Okay?
thank you.
And I certainly am not going to hold you against you if you vote no on that. Okay. Representative Parsons.
Thank you, Madam Chair. I guess this question is to the author of the amendment. I mean, this is something, the CON issues have been something I've been dealing with to some degree on this committee for 24 years now, and I've seen both sides of it. First year or second year I was here, I co-authored with the chairman of the committee then a bill that would have done away with CON altogether, and then I learned through the process, that there's sometimes need for it. So, but I would just ask though, isn't that what the CON is all about? I mean, that would be, people who have had an opportunity to to research this stuff to decide whether these things should be offered or not. And if there is a need, then they would be available to be offered anyway at a particular hospital or facility. I mean, what you're doing, what this would be doing is asking us right now to make a decision that would be made by people with much more expert knowledge of all this through a CON process. Isn't that true?
That is true, yes.
Representative Blight, do you want a vote on your amendment?
Yes, a vote would be,
Fine, you want to vote? Representative Jaspers, okay, hang on.
Yeah, Madam. Thank you, Madam Chairman. It's my questions to the amendment author. It says, any group tried, been turned down or delayed to start or create, a alcohol, drug abuse, and mental health service center that we're trying to get around here?
yes, but can you, what line are you on? I'm sorry.
I'm on, my question really addresses what you have on line 15, 16.
Right.
But the question is, has any group, organization been turned down, delayed, to create or start one of these, do the current process that we have?
It is my understanding that they have, yes.
And I will tell you, Representative Jaspers, that there is a feeling that the CON is such a difficult process and that the hospitals fight it so that the cost is astronomical, and that discourages people. I mean, that's just the facts, not my amendment. Okay, that's the okay. Representative Hawkins, last question.
I just have concern with this amendment here. This is a massive change to the direction we've been going in, and we've not had a lot of discussion about this. We haven't heard from the different groups, and I know that I know there's a lot of competition out there. I know we got in-network, out-of-network issues. We've got so many issues that this is a massive change. I feel like it's coming too quick without a lot of discussion. That's all.
Okay, Representative Fry.
Thank you, Madam Chair. I just want to reflect on what Representative Hawkins said too, is how many, I've got a bunch of questions about this. How many mental health facilities are there existing in the state that are private? What impact are we going to have on that type of industry? Not that I'm trying to pick a winner and loser. I just want to know the information before I would take a vote on something like this.
I don't have the numbers, I don't have the numbers with me on that. And there may be someone in the
Audience, do we
that could
have
answer.
somebody from, is that under this DBDH, the number of beds that we have that are available through the state? No one's here? That's not DCH, is it? What'd they do? All decide not to attend the meeting? There you are, Andrew. But you, yeah, but you used to be, so I figure you know. Come on, you haven't been over at DCH that long. How many beds do we have?
I don't know, and I don't want to speak.
Okay.
I have been gone for about 15 months from that
Okay.
department, but thank you, Madam Chair. I do believe they're currently still operating, if I speak correctly, 5 state hospitals. I can't speak to how many today. Obviously, the private psychiatric hospitals would come under our purview, under the Health Planning and Health Facility Regulation Division, but I don't know exactly how many. I can find out.
Okay, thank you. I don't think we have a lot. There's been a movement in the country, and I think Andrew went through this when he was at DBDH, to reduce in-house beds on sorts of all areas. Am I not right? They're moving for, when we were under the federal, to sort of reduce the number of in-house beds
And
across the state.
so officially, I would defer to DBHCD. But that being said, I know while Commissioner Berry and I were there, and they have continued since then to significantly increase their crisis capacity
Yeah.
to deal with acute situations, as they've done that and started to beef up some of their outpatient services in conjunction, there has been less need for the longer-term inpatient. However, when it's needed, it is there and available.
No problem. Okay.
But again, I would defer to them.
Thank you. Okay, I'm going to take Representative Hawkins.
Yeah, just I'll make a comment. You know, we're still struggling with the mental health. We had some really great facilities in the state, Brookwood in North Atlanta and the Northwest up there in Rome. And the federal government decided that those were mental health homes that were backwards and need to be shut down. I spent a day at Brookwood. They were not backwards facilities. They were great facilities that really treated Georgians on a daily basis, where parents could bring the kids in and take them home. And so when we get into this kind of, these changes, when we haven't recovered from that yet, it just troubles me, because we're talking about defenseless people. And I think we need to take a breath and really do a study of what all this really entails. Because we haven't fixed the problem yet, and to me, it looks like we're creating another one on top of it.
Okay, thank you. Representative Peak, last question.
Madam Chair, while I agree with this amendment and supportive of it, I'm going to make a motion, if you allow the
Sure.
process to table this amendment at this time, for the overall health of the bill, quite frankly.
Okay.
We table the amendment. I move.
All right, we got a move and a second to table the bill. Everyone in favor of tabling the amendment, if everyone in favor of tabling the amendment, say aye.
Aye.
Anyone opposed, no? No. I think the ayes have it that time, so I don't think we have to do a hand vote. Okay, moving on to the bill. We have an amendment that will travel with the bill. We're in a posture for having a motion do pass and a second. I want to read something that came to me at 2:19 today. Doesn't have any thing to do with CTCA, but it has to do with a cancer patient's choice. Hello, Sharon. It's Michelle. And this is Michelle Kelly, who lives in my district. I've known her husband since he was about 12 years old. I would like to call and talk to you in person. Oops, wait. I'm techno. But I don't know what the best time would be. I want to thank you for all your help with my radiation treatments. I finished my 4th one in October and just got my scans, and things look stable and shrinking. Without you, I would not be here. I would like to come see you in person, and thank you. This was a case where Kaiser, and I will tell who did it, let Michelle, and she's about 43, with a terrible kind of cancer. And they sent her to Osners in New Orleans to let them diagnose the kind of cancer she had. There were 2 places in the country that would treat it. At the time, it was right in the process of being an accepted treatment, literally after she had her first treatment. And so anyways, all I did was go to Kaiser. I didn't do anything really special. I asked them to make an exception, just like on step therapy, you go and you beg for an exception to something and base it on it. And Kaiser was good enough, since they had let her be diagnosed and told her where she should go, that they let her go to Houston, which was one of the places in the country that did it. She basically was dying before that. Now we are a year and a half down the road. And this is the thing I got from Michelle this morning. And if anybody thinks I made it up, I'll be glad to let you see my cell phone. It's choice. And that's the only thing about giving Georgians choice, whether it's to go to Ochsner's Clinic and be diagnosed, or go to Houston for treatment. And I will tell you now that that treatment has been approved, and they are doing it at the Winship Center. Or whether it's to go to Winship, because it's now there. It wasn't available at the time. Or to go to CTC. You know, this bill is about choice. Okay. Last days of session. No. Okay. All right, we're going to vote on the bill. Everyone in the favor of the passage of substitute to Senate Bill 31 as amended with the first of Representative Lott's amendments, raise your hand, because I know I'm not going to get, okay, all right. Okay, everyone opposed? Okay. the bill has failed. So, and that's your right. So we have a move for reconsideration. Do I hear a second? Okay, everyone in favor of giving Representative Peak a chance for reconsideration, say aye. Aye. Anyone opposed? No. Or the ayes have it. So at the proper time, we will have the bill come up for reconsideration. Thank you very much to the members on that one. Okay. We have a substitute to Senate Bill 81. Has everybody got your? Huh? Yeah, I mean, no, that, right, thank you. Okay. Okay. Who do I have that's going to present this substitute? Okay. David? Okay, everybody, listen up. Will you identify yourself?
Thank you, Madam Chair. My name is David Tatum with Children's Healthcare of Atlanta. Children's is the entity formed by the merger of Eggleston Children's Hospital and Scottish Rite Children's Medical Center back in 1998, and we've grown to where we also manage Hugh Spalding Children's Hospital for Grady. We own the Marcus Autism Center and 28 neighborhood locations around the metro area. Last year, we saw over 380,000 individual children, generating well over 1 million patient visits, and we don't see that demand lessening. We are also 58% Medicaid. We have the highest Medicaid payer mix of any hospital in the state. This legislation is a response to requests to us from 4 large adult hospital systems to have us come and locate beds and services physically on their campus. The current Certificate of Need law and regulations do not contemplate what they have asked us to do. All this bill does is create a definition of a co-located children's bed. It is not an exemption from CON. It does not provide a special CON process. It requires that a regular CON application be made in conjunction with the adult hospital where these beds would be located, and anyone who wants to oppose that or appeal it has all the standard rights that they have under the current law and regulation. We're not asking to change that in the least. In fact, if we go down this road and locate beds at an adult facility, and generally what we're talking about is something like maybe a 16-bed unit and a pediatric ED, and let's say a few years out the marriage falls apart, then this provides that the beds revert to the host hospital. We don't get to retain them in any way. It's a lower capital cost to put our services outside of the 285 perimeter. Currently in Georgia, under the CON and the licensure regs, if you build a new hospital in an urban county, it's got to be a minimum size of 100 beds. That's cost prohibitive. In a rural county, it's got to be 50 beds. For a children's hospital, that can be cost prohibitive. There's a definition at the first part of the bill that defines what a children's bed is. We would like to have these beds licensed under our license, participate in the provider networks where we have managed care contracts, participate in the Medicaid reimbursement for the pediatric peer group to make this work. Augusta Medical College of Georgia has expressed interest in joining this definition. They have a large children's program and they're a state facility. There is language in this bill that includes them. Also wanted to let you know that we did discuss this with the Department of Community Health and the administration some months ago, and the feedback is they would prefer to have it done through legislation. So here we are. I'll be happy to answer any questions.
Representative Hawkins.
It was designated as a children's hospital, your Medicaid reimbursement is higher?
It is slightly higher. There is a peer group
All right.
made up of the freestanding pediatric hospitals. It's been that way since 1997.
So it helps you better serve those Medicaid patients, those
Well,
Medicaid children?
Yes, sir, and even with the add-on from the provider fee, we lose about 13 cents on every dollar of cost, not charges.
Right,
We don't make that up on volume. The more you treat, the more you lose. So it helps.
it helps. Good.
All right, other questions? Representative Hilton.
I guess you may have already addressed this, but I mean, is this an exemption from certificate of need?
No, sir. All this does is define another category of healthcare facility under the current CON statute, and of course, the department would implement the regs to address that. But it is not an exemption. We would still apply jointly with the hospital who wants us there, still go through the regular review process. If somebody decided to oppose us or appeal us, same process there. It is not an exemption.
Thank you.
Jaspers?
Yes, sir. Thank you, Madam Chairman. Just so I make sure I understand it, so let's say if this hospital has a CON of 100 beds, you're saying, that if I've got this right, just first I've looked at it, that it would be, if they wanted to give you share 20, they'd have 80 then, or if you wanted to, it would be 120 at the original hospital?
Well, if they wanted to use some of their existing inventory to transmute to this, then they would have to apply for a CON to convert. We would have to apply for a CON with them to license under our provider number and our license. So the number would remain 100.
Yeah.
Now, if they decided they would like to add 20 beds and make that what we would like to operate, then we would go through a CON process, and if approved, their inventory would go to 120.
Gotcha. Thank you, ma'am.
So this actually could help some of our hospitals in our rural area that maybe are not filling up their 100 beds with the census on a regular basis, but could have, 20 beds or whatever empty, and there would be a way of working at a more full capacity. correct?
There has been one request made of us that I'm aware of, that the hospital is not fully utilizing their current inventory, and this could be a way to help with that.
Okay. All right. Representative Bennett.
Madam Chair, I think you just answered the question. Thank you.
Yes, ma'am.
Okay. Representative Lott.
Representative Jaspers asked the same question I was going to ask. Thank you.
Okay. Further questions from the committee? All right. Anybody want to speak on this from the audience? Okay.
Good afternoon, Madam Chair. Ethan James with the Georgia Hospital Association. Children's Healthcare of Atlanta did mention this to us previously, and I do not view this as an erosion of the certificate of need process. He is just clarifying another category for it. So we do not stand in opposition to this bill.
Thank you.
Happy to answer any questions.
I do appreciate you seeing the need for this kind of care for children across our state, for the Hospital Association. Okay? But, okay. And, David, I would like to carry the bill. And I will tell you if anybody gets nervous. And Deb Bailey, I think, can you stand up, please? Do you remember me? Do you remember asking me to open up CON to do something for the hospitals a few years ago? About how they get taken, appraised, approved by the national. How quickly we forget.
Oh, yeah, no, I tried to keep CON off that bill.
No, but it opened up. No, but you opened it up. What was the agreement? That I would carry the bill, and I would not let anything be added to it.
That was when we changed Joint Commission to D.
Right, that's what I'm talking about. That's what I'm talking about. And that if anybody came to me, I would come to you and see what you wanted. Right, and I kept my word.
Yes, ma'am, you did.
And I, give you my word in front of all these people that the same thing would be true. I feel that we have the need for being able to better treat children. Having taught pediatric nursing, they are very different. And for many people, I think it would be a real addition to their communities to have CHOA or the Medical College of Georgia's children in that. And I hear Savannah has a hospital or something, I thought, and maybe that they're even interested in the beds for our children. Is there any further discussion? I'm ready for a motion. Okay, I've got a motion to pass and a second. Any more discussion from the committee? All right, everyone in favor of the passage of the substitutes to Senate Bill 81, say aye. Anyone opposed? No. All right, I have one no. The ayes have it. Thank you very much.
Thank you very
And
much.
that's all we have, isn't it? To the committee, we will be, this is the end of the days, and bills are still coming up from other people and so forth, and we will probably be meeting on Monday. Oh, wait a minute, that's not. Excuse me, we're not through. I have asked the Secretary of State's office to come and talk to us. Where's Candace? And this is really, really important. I'm sorry if y'all will stay. I'm sorry, this is really important. Okay. Right here, yeah. I will tell you that there is a bill on the other side to move the Board of Nursing from the Secretary of State's office to DCH. Passed the Senate, but there are those of us on this side that have concerns about it. And 2 days ago, Representative Lott and myself met with the chairman of the Board of Nursing and the past chair and people from the Secretary of State's office to get out in the open and see what the complaints were and to have the Secretary of State's office answer those complaints. One of the complaints that we were hearing was they were not meeting their needs for investigation as quickly as the Board of Nursing thought they should do. And I will ask them in a minute to tell you. There was a complaint because the Board of Nursing wanted a new computer system. And I will let the Secretary of State tell you why they said hold off on that new computer system right away. Like I say, Representative Lott was with me. We had questions. They wanted more independence, but moving to DCH, there's no, they are still a state agency having to, vie for what part of the budget they will get under DCH. There's really no change. And so I thought that since we're having all these calls, and after that meeting, which I think Representative Lott will say went, we thought, extremely well. It was in the governor's office. He is staying neutral on this with Katie Childress, who heads up our legislative council, not to have her come in on it. Well, for one thing, it's the only place we could find to meet was in her conference room. But it was she was just an observer and getting the questions answered for her. Apparently, the nursing people went straight to the lieutenant governor's office and then to the press. So I thought, letting you hear it ahead of time, I would let them share, the Secretary's office share with you. Okay. Please identify yourself and start on answering those questions.
So my name is Candace Brose. I'm a staff attorney for Georgia Secretary of State Brian Kemp's office, and I also work with the press in our office. And I wanted to thank you, Madam Chair, and members of the committee for letting us be here to provide an update on the status of our operations with the nursing board, which is the largest licensed population under our agency's purview. One particular piece I think that we would like to provide the update on is nursing investigations. Following the implementation of mandatory reporting laws in recent years, there's been an effort in our agency to make sure that we are ensuring patient safety and working with the nursing board to further the purpose of those mandatory reporting laws. And that is why our chief investigator, Russell Lewis, is here. He can provide an update on the status of our investigations with the Georgia Board of Nursing.
Thank you, Madam Chair. I know there's some discrepancy in what the nursing board says the numbers are and the average number of days in investigations, and I'd just like to first point out to the board the difference in the way the numbers were put forth as far as information to the legislative body. The nursing board, in calculating the cases that are in investigations, aren't carrying forward the whole amount of referrals that come to us from the board to investigate. We do what we call hand-serve investigations for them, where we have to go out and locate individuals and track people down around the state, either for service of orders or MPEs, medical physical evaluations, or to locate for notice of hearing purposes. And these are individuals who don't want to cooperate with the board or don't want to talk to the board or the Attorney General's office for that matter. So we have to do those cases. So they didn't calculate those cases, which we did 125 of those cases in 2017. So the number that you may hear from the nursing board of being cases in investigation may be close to 300 days. It's actually 189 days. So we realize that's not as low as we want it to be, but because of the issue and how the mandated reporting law came about in 2013 and then was funded in 2014, our caseload significantly increased because of the law. Now, we were expecting that. And we were in support of the legislation because we care about Georgia's patients as well as anybody. But part of that was, in going forward, we didn't know what to expect. So that we were tasked and given 3 dedicated nursing investigators to handle that load. Well, we quickly found out that wasn't enough. So we had to task other resources that we have at the Secretary of State's office. And we have a wide variety of responsibilities that we work on. We also have elections, securities, charities. There are 40 other boards that we do investigations for besides the nursing board. So we have to balance all those resources against what the needs are. So we provided additional resources to the nursing board in the way of 2 more full-time investigators that we pulled off other things. And then on top of that, we partially assigned or part-timed investigators to work nursing cases as well as their regular caseload, whether it was election cases or other board cases. So we feel like we've done a lot to make the nursing board happy, and we continue to work and are committed to work with them.
Okay, all right, let me, and I'll let people ask you questions, but I don't have to call you, you're a criminal investigator, right? You're a law, I mean, you.
My division is made up of 38 individuals. We have 22 sworn law enforcement officers. We are post-certified police officers in the Secretary of State's office, and those are the individuals who conduct the investigations.
Okay, Andrew? Did Andrew step out? Don't let him. Okay, Andrew. Okay, when I ask you about DCH, and if the board should come there, and I was asking about investigators. You told me you had investigators, but they were a different kind. They're not police officers. They're
Correct, Madam Chair. So today, we don't employ at DCH any investigators. In our Health Facility Regulation Division, indeed, when we're involved with complaints or other risk that show up in healthcare facilities, we do have nurse surveyors who operate through our Health Facility Regulation Division and go look at risk at a particular place and look at a number of things. But again, our jurisdiction is around the facility, not around licensed practitioners. And so in the event there were an issue there, we would actually make a referral to the entity that oversees an individual. So we do not employ investigators.
okay. So, and I think the legislation that was proposed said that the nurses would take only 3 when they, if they moved, only take 3 investigators with them. And we've already seen that it's taken closer to 6 and, may need even more as they grow. Okay, that answered a question for me about the differences. And I will tell you, I didn't ask the nursing board to come today because when it was heard on the other side, they only listened to the nursing side of it. I think that y'all were supposed to have a few minutes and you got about 4, if I'm not mistaken. So I thought we would just sort of even it up, and after the meeting that Representative Lawton had, and you can, Representative Lawton, anytime you want to chime in about what we heard at the meetings, just let me know. That we had sort of tried and got an overall view from the nursing board and tried to come and tell you that, okay? Do we have questions? Representative Henson, okay.
Thank you. I have had something brought up to me in the past about the nursing board that I have a great deal of concern about, because we do have the problem with restraining orders, women moving, and a lot of nurses are women. So, you know, as stalkers or anything else, when they move, they have to update their address with the Secretary of State's office, not a P.O. box number, but their actual physical address, which someone could look up their name on the Board of Nursing and get their actual physical address. Is that correct? I see you nodding yes.
My understanding was that it doesn't necessarily have to reflect your residential address, that it could also be that your business address could be listed. But I will say that if that is a current problem, that we're committed to changing our processes to make that information protected.
But why am I the only one and the first one bringing this issue up to you? Because it is a concern. I mean, you know, folks that are being stalked,
Okay.
or someone that has restraining order against a violent husband, boyfriend, or something, the fact that they can keep moving and their address is still available
Well,
is
I-
of great concern.
I'm sorry, I did not mean to interrupt. I would say that if you have a kind of a protective order in place, that we could rely on that authority to protect that information. I'm not aware of a circumstance where that has been requested.
Would it have to require a protective order?
Not necessarily. I
Okay.
think that we could put processes in place to protect that information in a variety of circumstances.
Representative Henson, let's stay on the issue of the nursing board, but I don't, I'm sure if you wanted to bring legislation
I don't think it
next year-
needs legislation. I think they should be able to do it.
Well, they're restrained like other departments and have to follow the law, so I think we probably have to have legislation for that.
Yeah.
So,
We will commit to researching that for you and finding out exactly what we can do now and what kind of change that may require.
Thank you.
Quick question. Are you referring to people, were you next? Are you referring to nurses that move out of state or stay in state?
Stay in state.
Well, that's not, I'll talk to you about that later.
all right, Representative Beverly, get between those two ladies.
Really?
So,
Those are my members. I love them to death. So I really do. They're wonderful women. And I love you too, Matt. So just for the record.
oh,
Madam Chair, I just so that I sort of orient myself to the sort of infrastructure of the conversation, the nursing board is represented, and we talked to sort of the president of the nursing board, the whole board. Was it just
no,
a small
it was-
sample of the board?
No, it was
and
the
then-
nursing board, the nursing president and the past president
Okay, all right.
were the
very
ones
good.
there.
All right, very good. And then there was a discussion, if I'm to understand this correctly, around this issue, but there weren't the requisite people included in that discussion.
Like whom?
Like, I'll talk to you offline. And
Oh, okay.
no, just because I have a question that was raised, and I'm trying to figure out how this will impact Middle Georgia and Bibb County, and there was something that was raised, and I just
Okay.
want to kind of pick your brain about that before I.
About it moving or whatever?
Yes, ma'am.
Okay, because, I mean, they were the people, they chose to come talk to us, okay? And I mean, and they are the current president and the past president. I mean, a lot of the complaints that they have and what we've been hearing over the years are complaints that happened when we were in one of the worst recessions the state has ever known. And there was a lack of staff for all of us. Teachers were cut, everybody in the department. And so a lot of the complaints and the buildup of wanting this move comes from, but as it was presented to us, Representative Ott, they've corrected those in the Secretary of State's office, is that?
Mind if I-
Go ahead, no.
So we're getting a lot of emails on it, as we do with all of our issues. One of the things that we discussed when we were in this meeting together is that for nursing right now, it takes 1 day for a renewal of a nursing license. There are 171,000 nurses in Georgia, and it takes 1 day for a renewal, and it takes 7 to 8 business days, if I got this correctly.
That's correct.
For a new licensure, a clean new licensure. That was one of the old complaints that came up during the recession time, where there were things we were working through, and we've really gotten a long way. There was also an issue back in 2014 where we weren't having our calls answered properly, would be maybe the word I use, or appropriately, or in a timely fashion.
Timely fashion.
And now it is my understanding we have 5 specific nurse call center folks just for the Department of Nursing. And I have had to, as many of you I'm sure as legislators, I've had to call, and I've had to call as a nurse myself, and I've always had, now at this time in my life, this is very easy to get our calls answered. And I think you have more specific information on what your call drop rate was, and that kind of data. I think that it's important people know that.
We've had a significant improvement in our call center following the resources added for specific nursing call center agents. One figure that I think is an excellent metric would be that for fiscal year 2017, the 5 dedicated nursing call center agents answered 106,000 phone calls, and there was an abandonment rate of only 4%. The speed with which the call was answered was dramatically improved, and we are doing even better. Right now, our current abandonment rate is 2%, and we've already answered close to 100,000 calls this
Right.
fiscal year.
One of the reasons we're doing this to my members is that we want you to know how quickly you can get your license now. It's basically 1 day for renewal and 7 days for what?
New licensure.
New licensure. Now, what I want them to walk you through is, if there is anything when somebody wants to come into the state or with a renewal of their license, if you check a box that you've had a felony or anything like that shows up, that gets kicked out. And that goes to the board of, the Board of Nursing gets it. And that's when the investigations start. And, and that, if there's anything that turns up in their folder, that's when you start having the timelines. Is that correct? Because it takes time for an investigation.
Right, it requires additional diligence from the 22 staff members that are currently dedicated specifically to the nursing board to check into the applicant's history and gather additional documentation. But otherwise, clean first-time applications are being processed in 7 business days or less.
Okay. And what was the staff level for the nursing board during the recession? What is it now?
Right now, we have 22 dedicated staff that solely work with the Georgia Board of Nursing. That is more staff for one board than any other board in our agency. And that reflects the volume, the total licensed population. That is the largest licensed population in our agency. But even when you compare it to the next largest division, which involves multiple boards, they have a staff of 11. So the Georgia Board of Nursing, we have worked tirelessly to get additional resources, and we are incredibly thankful to the Governor's Office of Planning and Budget for helping us with that. We continue to see improved metrics year after year.
Well, and one of the reasons that Representative Lott and I wanted to meet and thought it was good to meet in the governor's office is because we wanted somebody who works with us to hear that we have this increasing need, because unfortunately there are more and more reports of nurses with drug problems, with alcohol problems, with all sorts of problems. I mean, that was a registered nurse, at least one of them, that laughed while a patient died in that nursing home. And, so unfortunately, and some makes me a little ashamed of my profession, there's more and more of that coming. And I would say, on drug diversion and all, nurses we've always had a lot of access to the drugs. We're the ones giving them out. We pass the pills out. We draw up the drugs. So there's been, when you work 24 hours, when you cover a patient 24 hours a day, you have an access to, and I guess for many people being tempted with perhaps diverting drugs and taking things. What about, now, I heard so much about this computer system, and as you know, I'm pretty computer illiterate. What was it called, Optimum or
The acronym is ORBS. I believe it stands for Optimal Regulatory Board Support. I've got it somewhere buried in my notes. But it essentially, it's a database that's offered by the National Council of State Boards of Nursing. It has been presented to the board as potentially a free option to help them with information sharing for licensure across state lines. I think that in doing our research on it, we see that it could have potential for the state of Georgia. At this point, we are waiting to see another state fully implement this system because it is in early stages, especially because Georgia's nursing population is so large. We want to see a successful rollout in a comparable jurisdiction before we move forward with it. But we are in constant communication with representatives from this national association to find out where they are in those stages.
Okay, and it's my understanding that Texas, which might be somewhere comparable to us, probably maybe even larger, is now in the process of trying out this new computer. But is it correct, my understanding, that there are several smaller states that have tried it and run into problems?
That's right, and I think any system like that will require, you've got to work out all of the kinks. But 2 of those jurisdictions specifically had primarily paper systems for licensure. So this option to them was brand new. It was the only information technology that they could pretty quickly implement that would bolster their otherwise paper system. So that is part of our consideration in waiting to see another state, perhaps Texas, roll it out.
Okay, Representative Henson, did you have a question on that?
Just a quick one. How many nurses did you say we license here in Georgia?
It's over 176,000. The
Thank you.
majority are registered nurses.
Okay, thank you.
That includes, includes LPNs, licensed practical nurses too. So Representative Parsons.
Thank you, Madam Chair. I had a question about, I'm always intrigued by the different departments to find out how many state police we actually have in this state. Now, how many state police do you have as official police that investigate?
As I say, we have 22 sworn law enforcement officers in the Investigations Division for the Secretary of State's office.
22?
22. I also have 14 inspectors,
Okay.
but they are not sworn.
All right. Well, I appreciate that. I want to ask, Madam Chair,
Yep.
I know apparently we're not taking that.
Oh, no, this is just information because it's come up and I was sure people were gonna get calls about it and.
Yeah, but I wanted to ask you now, and you had mentioned that the nursing board, I think, or somebody from the nursing board had testified in the Senate, when they had the bill there. I'm just wondering, are you gonna have somebody from the nursing board come in and present to us like this?
We're running sort of out of time on that. And the reason I didn't, did you hear me say? It's not a bill. And over on that side, and I'm not playing tit for tat, but right at the moment, since they've chosen to go to the press, and, you'll be able to read their side of the story, at least as they perceive it. I thought it was a chance, and they didn't let the Secretary of State's office even have a chance to present over there, or like for 4 minutes after quite a lengthy one by the board. I mean, like that. So that's the only reason, is because you're gonna maybe start hearing things, and the people that run it, I thought you might like to hear. I told you what the problem. I was trying to tell you what they're saying, in that they're not moving on the research fast enough and all. Okay, we have other questions. I will tell you that I have one more, and it has to do with how the nursing board is handling private complaints. and this is just an informational thing for you. In the health field, the boards are able to issue private orders and open orders. Open orders go out to the public where they can see the complaint and what was done about it and what happened to the nurse. Private orders are not available to anyone, even by subpoena. So there's no way of knowing it. In the other boards, and I can get you, I have, and you may have with you, I just happen to have with me, the numbers. Like, for a 3-year period, the medical board offered 59 private orders. Okay, they use them for the most extreme cases. And from the medical board, we can know what happens. If a doctor is accused of drug abuse, and they go before the board and willingly admit to the board they have a problem, their license is suspended. They go into a treatment facility that they pay for themselves. They have all sorts of evaluations and a forensic psychiatric evaluation. When they complete that program successfully, they are allowed to go back into practice, but they are monitored with spot-on checks without them knowing when the people are coming to do drug tests and so forth. Now, this would be doctors, chiropractors, these boards. I mean, but I know, and the reason I know this is because I went to the board and asked them to explain it to the speaker and all, and they sent over the person. The one with the medical board is so thorough that it is gaining national recognition among the medical boards across our state. The nursing board has chosen and says that the information and the parameters that they use to decide whether an order should be private or not is confidential. So they will not tell us what parameters they use to decide whether an order should be private or open. And can you give me the figures on, now remember 3 years, 59 for the medical group, what they do for the dentist, and do you have that for the dentist and over a 3-year period?
I believe I do, if you'll give me just a
Do you
second.
have it? No, okay. Board is, and she can hunt the numbers up, the nursing board is doing over 50%, sometimes 60% of the year, their orders are private orders, which means no employer, even the ones that supported them, and I think the Atlanta Hospital, they tell me that they had a request, somebody in one of their departments asked if they could have some kind of report, and we're told no. So the employers have no way of what's happening, whether the people are in a program or whatever. And I find that very disturbing when they would make even the parameters of how they judge a person or a private order and that we can't get to it. And at least just know the parameters. I mean, do they make them go into a program? Do they suspend their license? Do they have people do spot checks on them? How long does it last? And to me, that is a very disturbing with the number of complaints that we are getting, and it's way out of proportion. Have you found it, Candace, the numbers? Okay.
Yes, ma'am. I have to preface this by saying I have to tread very carefully here because, as many of you know, the Attorney General's office provides counsel both to our office and to the Georgia Board of Nursing, and they have assigned assistant attorneys general that provide counsel to each of the respective professional licensing boards.
Well,
And
if you
this is
can't do it,
based-
you just, I mean, you know.
Right, okay. All of that to say that, I can give you the statistics. For fiscal year 2017, there were 233 private orders issued by the Board of Nursing. And for fiscal year 2016, there were 449. And Other than that, it's not tied to a specific licensee, and you would not be able to search a nurse's public record and know whether she has got a private order issued against her.
Or that any action has been taken. And it's, you know, just one of the things that we find concerning. And when we passed the nursing compact last year, you'll remember I had a little something to say about Representative Lott in that compact. I wasn't against the compact. I wanted us to take times to look at it more. And I had talked to that national board and gotten my information from them. What we find out now is, remember, that is the one where we were going to have, you could have a statewide license. And if you had one of those, you could come into Georgia. And we felt, you know, and I think it is very beneficial that if you live in South Carolina, you could come across and work in Augusta, Georgia, without having to get another Georgia license. But the law was said that if you decide to live in Georgia, you had to get a Georgia license, and that compact license wasn't good anymore. Well, the way it was implemented by the board, they found a way. We have, and this is correct, and you tell me, that we have no way of knowing how many nurses are using the national compact to come into our state. We have no way of knowing if they decide to live in Georgia because of the way it's set up. So we have no way of tracking or knowing who's our state. And the biggest problem with it, our Board of Nursing says they cannot share private orders with the national board. So if a nurse that has a private order in this state goes to get a compact license, the information about a private order would not go to that national board. And apparently some of the other states are not sharing with us that a nurse has had a private order, which could mean a drug diversion or something that we would want to know about. I find that disturbing, and it's the way the board has chosen to go. So, especially with the number of private orders that are being given. The other boards, like I said, use private orders for the extreme cases that really need to be worked on. Those are my concerns. I'm not against the nursing board. I just, think we need to move carefully. The other things they have been saying in the hall, because they said it to me, that there would be no cost to moving this board. And there is a fiscal note on it. What does the fiscal note say?
The fiscal note indicates that there would be a one-time transfer cost of just shy of $800,000 to move them from Secretary of State's office to the Department of Community Health, and that the board's operations, if they remain largely the same, once moved to DCH would actually cost up to $1 million more per year to operate with largely the same duties.
And
as they
that's
are right now.
Fiscal office being conservative about it. I think they said to me that it could go up another $1 million. So there is a cost to moving the board. And my concern, as I told them, and Jody was there, is that things seem to be working much better now. Staff is trained. I'm afraid they could be jumping out of the fire at what they think is the frying pan into the fire, because DCH is not used to working with a board like this. They, became part of it, and I have concerns when you've got, it's sort of like I did on the step therapy. If it ain't broke, and at this point, I think the service to our nurses at our state and getting their license is not broken. We do have some problems maybe with patient protections on the orders, but going forth, I don't think we should jump into anything, but that's my opinion. What do you think, Representative Lott?
I would just like to add, for the sake of, again, all of us that are getting emails, the question that did come up at the meeting was, and I asked the question, so I'll say it the same exact way. What is it that is happening at the Secretary of State's office that is moving in the wrong direction? And as all of us that were at the table are aware, the answer actually was the relationships, not any of the actual function of the responsibilities. But I think that in fairness, some of what is happening is that our board does not get, they're not satisfied with the communication that's happening. So, which I believe where Chairman Cooper and I ended was, this is an election year that came up. There are things that are going to change at the Secretary of State's office, and this is the taxpayers' money that we have to watch over. And there was no actual data that was the problem. It was the relationships, and something that hopefully have been improving as well. But I think that was really the major concern with this, and that's what came out in the end.
Right, and what we said is, we are going to have a new Secretary of State. There's a chance for a new beginning with that relationship that could be without the more drastic step of moving the board to another area that hasn't dealt with this before. And anytime you move anything, there's problems. Senator, I just elevated you a little bit. Okay, Representative
Do I
Hanson.
get the same esteem he does?
Pardon?
I said, do I get the same esteem that the senator with my last name gets? You know, I've dealt with licensing boards since I've been in the legislature because of the committees I've been on. And I know that, you know, there've been many different issues. One of them has always been that we bring in X amount of dollars. The nurses will say we bring in X amount of dollars, but we don't get 100% of it going back to our board. It goes to the general fund. Therefore, we are inadequately funded for both our personnel and especially for investigators. Is this still correct? And if you were to be fully staffed today, how many more people would you have in the office and how many more investigators would you have?
Well, it's difficult to speak to that, and with numbers and not being prepared for those sort of calculations. Could we use more help? Certainly, we could use more help with the investigations that we conduct, and would love to see that. You know, I mentioned that earlier. The effect of the mandated reporting law that took effect in 2014 had significant impact on our ability to render services in a way that we thought was necessary. So that's why we brought more service to bear with the investigators that we already had on staff, in order to address the significant increase in the case flow for the nursing board. So we made those adjustments on the fly in-house because we were all dealt a certain amount of cards budgetarily wise, and we had to play with what we had. So that's what we did. We had to think outside the box without getting more personnel because, as Madam Chair said, there were times when the budget was flat. There was no need to ask for anything else because you weren't going to get it anyway. So we just did the best we could with all of that.
Is there anything else you'd like to say? I'm going to let my members that have stuck it out to the end, thank you, thank you, thank you. Okay, have you got a question? Okay, they get the last word if they have anything else to add.
We thank you for the opportunity to be here today to speak with you.
And as they told Representative Lott and myself, they are trying to work with the board. They are still continuing to work and be willing to work and beef it up and go forward with improving it. Thank you very much. We are adjourned. Everybody be safe on the way home, and thank you for sticking this out.